Hello, good morning, good afternoon, good evening. My name is EKENNA REXFORD, data science student of Calumet University. I'm about to present my internship report. My topic is profiling the prevalence and associated factors of presbyopia among selected healthcare workers in London, UK. Hope you have a good time listening to my presentation. For this presentation, we aim to discuss the following. What is presbyopia? Common symptoms of presbyopia, risk factors of presbyopia, aims and objectives of this study, research questions, research methods, some findings, visualization of results, then the conclusion. We start at the beginning. What is presbyopia? Presbyopia is an age-related loss of lens accommodation that results in an inability to focus at near distances. It is the most common physiological change occurring in the adult eye and is thought to cause universal near vision impairment with advancing age. Behind this slide is an image of the effects presbyopia has on the eye. What are some common symptoms of presbyopia? This list is general but not limited. The first one is having eye strain or headaches after reading or doing close works. Having difficulty reading small print. Having fatigue from doing close work. Needing brighter lighting when reading or doing close work. Needing to hold reading materials at an arm's distance to focus properly on it. Overall problems seeing and focusing on objects that are close to you. Then squinting. What are the risk factors of presbyopia? The first one, according to my list, is anemia, which is defined as a lack of normal blood cells. You have diabetes, you have cardiovascular disease, or difficulty metabolizing blood sugar. You have farsightedness, also known as hyperopia, which is a condition in which you have more difficulty seeing objects close to you than objects far away. We have multiple sclerosis, which is a chronic disease that affects the spine and brain. We have myasthenia gravis, which is a neuromuscular disorder affecting the nerves and muscles. We have eye injury or disease. We have vascular insufficiency, also known as poor blood flow. We now move to the aims and objectives of this study. What is the aim of this study? The aim of this study is to analyze the prevalence and associated factors of presbyopia among selected healthcare workers in London, UK. The objective of this study is as follows. The following research objective will be utilized to accomplish the aim of the research. Number one, to assess the prevalence of presbyopia among the healthcare workers in London, UK. The next is to investigate the factors associated with presbyopia among the healthcare workers in London, UK. The next is to investigate the needs of the presbyopia patients during the scheduled appointment in the United Kingdom. Research questions. In order to achieve the set objectives of this study, the researcher will answer the following research questions. Number one, how prevalent is presbyopia among the healthcare workers in London, UK? What are the factors associated with presbyopia among the healthcare workers in London, UK? What are the most likely needs suggested for presbyopia patients during scheduled appointments? Findings. In investigating the factors associated with presbyopia among the healthcare workers in London, UK, the result of the study showed that alcohol consumption, poor illumination, and not wearing protective glasses are factors associated with presbyopia among the healthcare workers. The finding of this study is in tandem to that of Hunter and Shape of 1997, who discovered that other than age, which is the major risk factor for the development of presbyopia, some other factors include side effects of drugs like alcohol, trauma, systemic disease, cardiovascular disease, or a drug side effect. Generally, individuals who read under bright lights or directly under the sun are likely to have presbyopia. Howard, Nathaniel, David of 2017 discovered that the lack of reading glasses or inadequate glasses lead to presbyopia. The chart below, or the table below, shows social demographic statistics of the age group and the gender of the questionnaire issued out, the percentage of male and female, and the age bracket for our study. According to the chart, which is the social demographic chart, it simply shows that we had much more male participants in relation to, while comparing it to the female gender or sex. This is the broad visualization of social demographic statistics or data for this our project. For this, I use Tableau to visualize this. This chart shows the need for presbyopia patients. NPP in the chart below stands for needs for presbyopia patients. So we have NPP 1 to NPP 10. This table shows how often healthcare workers complain about presbyopia related issues. According to this table, they often complain, and the percentage of that is 45.9, which is extremely high. This is just a chart showing how healthcare workers complain about presbyopia related issues. Conclusion. The study adopted quantitative method of data analysis in investigating healthcare workers in 5 selected hospitals in London, UK. The study discovered an extremely low prevalence of presbyopia among the healthcare workers. Alcohol consumption, poor illumination, and not wearing protective glasses are factors associated with presbyopia among the healthcare workers. Patients had the following needs during consultation: a need for extra attention during consultation, a need for their blood level and sugar checked regularly. There is a need for doctors to be very patient, a need for really old presbyopia patients to be accompanied by someone while coming to the clinic. There's a need for counseling to be given to presbyopia patients during consultation about their health, and a need for presbyopia patients to be encouraged to have more than one reading glasses. Recommendations. It is therefore recommended that more awareness should be created by health organizations and non-governmental organizations, as well as the government on presbyopia. Alcohol consumption, poor urination, and not wearing protective glasses should be discouraged by government as well as healthcare professionals, because it can influence presbyopia. Extra attention and patience should be given during consultation. Blood level and sugar checked regularly. Patients who are very old should be accompanied during appointments. Thank you. Thank you for reading. Thank you for watching my presentation. I look forward to getting a positive feedback from you. I want to use the opportunity to thank my supervisor, Dr. Sabine, for helping me during my uh, research work. By that I mean feedbacks and encouragement throughout. I want to thank the faculty and everyone who made this program a success. Thank you. Have a good day. Cheers.